Hello students, let's study hepatitis viruses. Classification of hepatitis viruses. So HAV is the infectious hepatitis virus, family enterovirus 72, that is picornaviridae. HBV, serum hepatitis virus, hepatnaviridae. HCV, non-A non-B or post-transfusion hepatitis virus, flaviviridae. HDV, delta agent, unclassified viroid-like. HEV, non-A non-B, enteric transmitted hepatitis, unclassified calciviride-like. Hepatitis A virus, infectious hepatitis, transmission fecal-oral route. Virus entered through ingestion, multiplies in the intestinal epithelium and reaches liver by hematogenous spread. Virus shed in feces during late incubation period and prodromal phase of illness. Clinical features: HAV, most common cause of acute hepatitis of children in India. Two-stage disease, prodromal or pre-ecteric phase, onset acute or insidious fever, malaise, anorexia, nausea, vomiting, and liver tenderness. Ecteric or jaundice phase, recovery slow, takes 4 to 6 weeks, no carrier, chronic state. Laboratory diagnosis: specimen, feces or serum. Serology: anti-HAV antibody detection, detection of HAV particles, HAV antigen detection. Isolation of virus, non-specific in test elevated liver enzyme, serum bilirubin levels. Anti-HAV antibody detection, interpretation. Anti-HAV IgM positive indicate acute infection. Anti-HAV IgG detection in absence of IgM, past infection or recovery. Detection of HAV particles, specimen, stool, liver, bile, blood. 2 to plus 2 weeks of jaundice, remain immunoelectron microscopy. Hepatitis B virus, HBV, serum hepatitis. Agent is DNA virus, icosahedral symmetry. Pathogenesis: transmission, parenteral route, blood transfusion, needle stick injury, sexual route, vertical. High risk group: serosurgeon, paramedical workers, sex workers, recipients of blood transfusion and organ transplantation, drug addicts. Carrier are grouped into simple carrier, low infectivity, low level of HbA/Ag and no HbE antigen. Super carrier, highly infectious, high level of HbA/Ag, HbE antigen and DNA polymerase, HBV DNA. Clinical features: non-specific prodrome of malaise, fever, headache, myalgia. Complication: fulminant hepatitis 1%, cirrhosis. Extrahepatic complications: arthralgia, urticaria, rarely polyarthritis, glomerulonephritis, hepatocellular carcinoma. Hepatitis B vaccine as a immunoprophylaxis. Composition: recombinant HbA/Ag, schedule 3 doses, intramuscular 0-1-6 months. Lab diagnosis: specimen, serum, liver biopsy. Methods: visualization of HBV virus by electron microscopy, immunoelectron microscopy. Serological markers: antigens, HbS/Ag, HbC/Ag, HbE/Ag. Antibodies: anti-HbC IgM and IgG, anti-HbS, anti-HbE antibodies. Molecular markers: HBV DNA. Non-specific markers: elevated liver enzyme, serum bilirubin. Hepatitis C virus, HCV, post-transfusion hepatitis. Mode of transmission: parenteral, exposures to infectious blood. Recipient of contaminated blood transfusion, blood product, organ transplantation, contaminated needles, sharp rings. Injection drug users. Vertical transmission 2%, sexual transmission rare. Does not spread via breast milk, food, casual contact, hugging and kissing. Clinical feature: acute hepatitis 20%, rest asymptomatic in early stage. Chronic disease 75 to 85%. Chronic hepatitis, cirrhosis, HCC, hepatocellular carcinoma. Extrahepatic mix, cryoglobulinemia, glomerulonephritis, arthritis, joint pain. Laboratory diagnosis: HCV antibody detection assay, HCV core antigen assay. Molecular methods: real-time RT-PCR.
Hope you find this session useful for your understanding and for your exams. Thank you.